Guys, well, we're always trying to expand here on Fantasy Football Live, and we thought, what's better than having one medical professional on the show? How about two? Why not three? With that in mind, I'm going to send it over to Dr. Greg Horter, who has some company and a new segment that we're calling Second Opinion. Doctors?
All right, so we're going to start this new segment, with Danny Woodhead. So Danny Woodhead was carted off the field after trying to make a recovery from ACL and a history of hamstrings. Blew out his hamstring, carted off the field. He's eligible to return apparently in week 8. I personally think that he will have some residual value. People should be looking at him in that week 8. But let's find what our second opinion and third opinions have to say about the matter. We'll start with Dr. James Chen, who's one of the top sports medicine experts in San Francisco. What do you think, James?
Thanks, Dr. Horner. Well, we all saw him go down with a non-contact injury, pull up and hold his hamstring, and need to be carted back to the locker room. These injuries are very well documented in the NFL, so we have a good history of how well people do. There's about 180 of these per season in the whole NFL. You'll see about 6 per team. Unfortunately, even though players do return, they tend to be nagging injuries. Probably about 20% of the time, someone will re-injure their hamstring. Let's go to some anatomy here, and
give it a good push.
Ow! Oh.
We're good. So here's some of the anatomy here. You have the 3 hamstring muscles here. If you tear your hamstring where the tendon attaches to the pelvis, that's a bad injury. That requires surgery usually. You're out for the season. We know that Woodhead didn't have surgery, so more likely it's a muscle belly injury. Those are more common. We're talking about sprains, tears, pulls. Those are graded 1 to 3. Something mild is a grade 1. Usually you're out 3 or 4 weeks. Something moderate is grade 2, 6 to 8 weeks. Something severe, grade 3, you're out 8 weeks or more.
But if you're carted off the field.
So there are a couple things that concern me about Woodhead's injury. Number one, this is actually a re-injury for him. He hurt his left hamstring in the preseason, and so he's been nursing that hammy. So, I think it's going to be a worse injury because it's a re-injury. Number two, he couldn't get off the field on his own. He needed to be carted back. And so anytime a player has to leave with help and can't go on their own volition, that's a negative prognostic factor. And probably most importantly, this is Woodhead's return from ACL surgery season. And so we already know statistically that productivity and output takes several years to return. There's really only one position where you surpass your previous level, and that's quarterback. So for Woodhead, that's not a good sign. And then we also know that within 2 years after an ACL surgery, you're way more likely to hurt that leg or the other leg.
That's right.
So he's in that 2-year window of re-injury. He has a fresh hamstring injury. For me, I think he should be dropped. I think it's going to be 8 weeks at least till he's back. I think if he does come back, it's going to nag him, and he's not going to produce like before.
So eight weeks is your thought?
Yeah.
Well, we also have another opinion in Dr. Sarah Edwards, who's the team doctor for Cal.
Go Bears.
Football team, go Bears. She's also a Northwestern graduate. Northwestern graduate here too.
Hey, we got to
Sarah,
shout out to my
think?
Bears for last night. They beat Ole Miss.
Big game.
I know,
Yeah,
big
huge
game.
game.
It was a great game. Anyway, I agree with Dr. Chen. A lot of the comments he said. The main thing we don't know is his grade of injury. So again, graded 1 to 3. 3 is the worst. Usually they're having surgery if it's a 3 in a player like that, a running back. So my estimation based on the fact he was carted off and they're giving us such an extensive time is that it's probably a grade 2 injury. I'm going to take a little bit of a positive spin on that though. Again, he's coming back from an ACL injury. He's been off, he missed most of last season with that and has been rehabbing. I think this just gives him more time to rehab that ACL, let the graft mature a little bit. And so, I think there's no reason to think he couldn't be functional within 6 to 8 weeks and hopefully stronger on both sides.
So there is residual value. My thoughts are, I agree with James. I think this is going to be really tough for him to recover. He will not be able to put up similar numbers as he has in the past. There is residual value. When he comes back up, it all depends on how desperate you are for a running back, and we know the league is pretty weak on running backs. There's lots of need there.
There's going to be a pop quiz later, by the way. You guys have to reenact that and make sure you pronounce all the names.
Are they going to
graphic.
undergo a brain transplant for me? Because I seriously need that.
That's like week 6 or 7.
Oh,
when it's
okay.
most
All right.
necessary.
Maybe I'll pass it then.
Doctors, thank you again.